So I'm Angela Soderberg, the Director of Medical Resource Management of Physicians Health Plan, PHP of Michigan. We are a nonprofit organization. We serve the lines of business of marketplace, commercial, PPO, ASO. We serve about 16 counties currently. We came across opportunities when NCQA came along for our organization. Currently, we're under a different accreditation, and so with NCQA, it poses a little bit of different critical essential tasks for us, which includes technology. For NCQA accreditation, we realized that we fell short in our documentation system and processes, so we tapped into Cognizant to look at what other solutions they may have for us for the case management portion of it. NCQA accreditation really helps improve operational efficiencies and along with evidence standard-based care. So this allows us to improve our outcomes. We're able to measure our quality metrics in a more fashionable manner and also be competitive against our other payers in the field. The Cognizant product that we selected is a TriZetto Care Advanced product along with the TriZetto Standard Context Package. We had a very short, runway of less than 6 months for us to have it launched and implemented before our look-back period. Especially since we have a very lean team at PHP, everybody has a piece of every kind of project. So when you tell your team that they have 6 months to implement something for a NCQA accreditation, which is already a huge project, it can be kind of unnerving and a little bit fearful. With discussions with Cognizant healthcare team, we realized that they have an agile approach that we could use, and we could do it in working sprints, and that we should be able to meet our 6-month deadline. So for the 6-month time frame that we had, we did do that agile approach with the sprints with the team. And so with the Cognizant team and with the PHP team, they really did a great job about meeting like 3 times a week, making sure that they had their tasks on time, resolving any issues before we kind of moved on to the next sprint, which really helped us be engaged and dedicated and aligned between PHP and Cognizant. So that really helped with that really collaborative communication and efforts that we had on both sides. The great thing about the case management program is that we're able to be proactive instead of reactive. That is one thing that we're really striving to be, is get in front of the member before they have a health crisis or a life event. And so we can do that by targeting individual members or populations. We can do that by using campaigns or other methods. So far, we've had quite a few success stories of the memberships that have already enrolled into our complex case management by utilizing those assessments. I would say that just the confidence in the system and the new relationship and partnership with Cognizant between us and PHP has been great. My team feels like they're heard if they come forward with a question or an opportunity, and that we take those questions or concerns back to Cognizant, and they're like, okay, we understand, let's resolve this together. The case management program has helped us engage our members in a meaningful and cost-effective way, which has helped us improve their health and well-being. And also during the implementation phase for the budget, we were able to come in under 16% of the budget. I just want to emphasize just on the relationship and the partnership that we have maintained and grew with Cognizant. I think that has been very essential and important for PHP. So I think that is one bonus that we walk away with. And when you look at the future, we can only grow together and enhance our abilities together.